Sir, how you will differentiate between lachesis and Bothrops?
Yes, basically, Lachesis muta is a snake remedy. Bothrops Lanciolatus is also a snake remedy. Another name for Bothrops Lanciolatus is a Lachesis Lanciolatus. This is the yellow viper. We have read the German viper, Vipera, where the action is very specifically on the nervous system and the venous system. In general, whenever you think about the snake remedies, you will have very specific action on the blood, circulatory system, and secondarily the nervous system. This is very common with the snake remedies. Being a snake remedy, this Bothrops is having very specific action on the blood, and there is a tremendous blood coagulation. This remedy is very useful for the coagulation whenever there is thrombosis to dissolve the thrombus. It helps a lot. So thrombosis anywhere, secondarily causing the paralysis. First problem lies in the blood. There is a thrombus formation. Coagulation is more pronounced and producing a paralysis, aphasia. Patient is not able to talk properly. Many times there is hemiplegia associated with amaurosis. Amaurosis is another condition which is explained in Bothrops. Amaurosis is that there is a sudden loss of vision without having any pathology in the eye is called as amaurosis. So this is one important thing. Lachesis is also having the similar type of action, but lachesis is well proved remedy. It has a very specific action on each and every organ. We have a clear cut indications of lachesis. Bothrops is very specific, and that's why when we used to prescribe Bothrops, we have to think specifically the pathological case having very selective action on the blood vessels, causing a thrombosis, producing a ischemia on the brain, producing a hemiplegia over there, specifically of the right side. Lachesis is left-sided paralysis. Lachesis is left-sided remedy. The Bothrops is right-sided remedy. Here you can get one important thing, that there is a pulmonary congestion. So pulmonary congestion is again one thing which is because of secondary failure to the cardiac failure. So the symptoms are very typically of the cardiac failure, producing pulmonary congestion, producing sometimes hemoptysis also. Then nervous trembling of the extremities, that is another thing which you can get over there. And inability to articulate while talking, while discussing. This is very important with this remedy. There is one terminology used by Boric which is called as a day blindness. The terminology which he has used is called as hemeralopia, that is a day blindness. Aggravation, when the sun comes up, there is a loss of vision. This is very important thing which you can get in this specific remedy. And the face becomes absolutely swollen, the besotted appearance, the puffiness of that. And this is related with the cardiac problems, nervous system problems, the brain problems. These are very specific of this remedy. Close resemblance is at the gangrene level. Lachesis is also good remedy for gangrene. The Bothrops is also good remedy for gangrene. But ultimately it is related with specifically at the level of blood, coagulation of the blood. Both acts on coagulation of blood, but Bothrops is selective while lachesis is constitutional. This is the one important difference one has to think about it. And it is also action on skin, the erysipelatous conditions which you can get over there in Bothrops. Lachesis is also having, but lachesis eruptions are having typical purple hue, violet hue, violet tinge, that is lachesis always have. Here whenever the Bothrops we think that there is a edema, puffiness, swelling because of obstructed limbs, obstructed lymphatic flow, and because of which there is saturation of the blood which you can get in this specific remedy. So this is basic difference between lachesis and Bothrops. Bothrops is very selective, having the action on blood. Lachesis is well proved remedy, having the action on all the systems over there. So one must think lachesis as a constitutional, Bothrops as a specific remedy whenever the pathology is indicated. So that's all. You can use the Bothrops in 30th potency. Some repetition it bears. You can repeat it 3 days, 4 days, and then you can stop till the action develops with the Bothrops. So that's all about the Bothrops. Okay.